I just wanted to take some time today and think about the use of the word why, both as a patient and as a doctor. So the importance of this word is to make sure that we are either getting the correct care when we are the patient or giving the correct care when we are a doctor. And both of us asking this question is very, very important. I just had a patient recently who was a young woman having pain during a couple different movements. And it was just low back pain, uncomplicated, didn't have it before in the past, and had seen another provider about 12 times without any real benefit. Then I decided to sit down with this patient who had returned back from vacation or from school vacation to consult with me for a continuation of care from the last provider. And what I did is I sat down with the patient and I asked, why does it hurt? And what the patient did is looked at me confused for a moment and said, well, I think I'm doing something wrong when I squat and when I deadlift because that's when it hurts the most. And from there, we had a point to work through. Because we had a why, we could form a plan. So within 4 visits, that patient went from pain during exercise at the gym and not ready to go out for a run because that also, as we found, was causing low back pain. We made a plan focused around the why, which was improving strength in the abdominal muscles. That was why the low back wasn't doing a good job at supporting the extra load, is because it was doing all of the loading. The hips were very uninvolved, the abdominal wall was very uninvolved, and the actual movement that the patient had during those motions that were painful were not the safest or most efficient ways to do those movements. So within a few visits of homework and just supporting those areas that were the cause of the actual problem, which was pain during running, bending, and lifting, we are able to resolve that and discharge the patient able to deadlift and squat 100 pounds without any problem. So remember to ask why if you're a doctor and explain why if you're a patient.